Hello everyone, I'm Dr. Pradheep Rachakonda, cardiothoracic surgeon from Continental Hospitals, Hyderabad. By the time you're listening, I think you're in state of complete lockdown as advised by Honorable Prime Minister Shri Narendra Modi ji. Briefly, I would like to emphasize and stress on why it is important to stay at home and why it is important to enforce this lockdown for the next 3 or 4 weeks or even more if required. We as a humanity as a whole is faced with a danger that we have not seen in the last 100 years or so. We are in the midst of this COVID-19 crisis where lakhs of people have been infected and thousands have been dead within the last 1 to 2 months. So why is it important to enforce lockdown and why is it important to stay indoors? For 3 reasons. First, if you or your family members already have contracted infection unknowingly, you don't spread it to the rest of the community around you. Secondly, if any of your neighbors or your community have the disease or the virus, you reduce the risk of you or your family members getting it. And thirdly, by reducing this community spread, you reduce the flooding of cases so that you give appropriate time for the health authorities to respond and hospital systems can treat patients. So why is this COVID-19 so serious and scary? 90% of the times they are mild infection, 5 to 10% of the time they cause serious infections. Only 1 to 2% of the people die. But it is serious and scary because of the potential to spread rapidly, and even young, healthy individuals who don't have any other disease carry the risk of developing serious infections. So friends, it's very important to stay at home, stay indoors, and stay healthy and enforce this lockdown. We as a humanity are faced with a challenge that we have to overcome, and I humbly request everybody to take this seriously, and it is the responsibility of each and every one of us to stay at home and enforce this lockdown and prevent the spread in the community. Thank you.